Today we'll be learning about the anatomy of the parietal bone, inshallah. So how do you determine the parietal bone? At first, we need to place the longest serrated border towards the median plane, and we need to project the anterior inferior, or the most prominent angle, downwards and forwards. So let's find the longest serrated border. So we can see this is the longest serrated border. We need to place it in the median plane, and there is the anterior inferior sphenoidal angle, which is the most prominent angle, so we need to project it downwards and forwards. Convex external surface, it determines the side to which this bone belongs. So you can see this is the convex external surface. So we can say this is the right-sided parietal bone. Now let's talk about the presenting parts. So we can see there are external surface, internal surface, and there are 4 borders. These are the 4 borders, and there are 4 angles we can see. Let's talk about the presenting parts of the external surface. So in external surface, near its center, there is an elevation. So we can see this is an elevation. So it is called the parietal tibur or parietal tuberosity. And you can see there is superior and inferior temporal line. The internal surface, it is marked by the impressions for cerebral gyri and the grooves for the meningeal vessels and venous sinus. So you can see there are impressions for cerebral gyri and grooves for the meningeal vessels and venous sinus. So there is a well-defined groove along the inner surface of the sphenoidal angle, we can see. And these, we can see, these are these impressions, and there is lodgement of the anterior division of the middle meningeal vessels. And this groove, it is formed by the middle meningeal vein rather than the artery. So you can see there is the lodgement of the anterior division of the middle meningeal vein. Along the posterior part of the inferior border, there is groove for posterior division of the middle meningeal vessels. So you can see there is groove for the posterior division of the middle meningeal vessels. And let's talk about the borders. So there is superior or sagittal border, there is inferior or squamosal border, there is anterior or frontal border, and there is posterior or lamboid border. And there are 4 angles. You can see this is the anterior superior or frontal angle, this is the posterior superior or occipital angle, this is the anterior inferior or sphenoidal angle, and this is the posterior inferior or mastoid angle. The anterior superior angle, it forms bregma. And what is bregma? Bregma is basically the meeting point of the coronal and the sagittal suture. We'd see that there is coronal suture and there is sagittal suture, so it is the meeting point of both of these sutures. And there is posterior superior angle. It forms lambda, which is the meeting point of the sagittal and the lamboid suture. And anterior inferior angle, it forms pterion. And what is pterion? This is actually the region occupied by the H-shaped suture, which is known as pterion, and it is the meeting point of 4 bones, and these bones are the frontal bone in front, and the squamous part of the temporal bone from behind, and the sphenoidal angle of the parietal bone above, and there is tip of the greater wing of the sphenoid bone below. And the posterior inferior angle, it forms asterion, which is the meeting point of 3 bones, which are the parietal bone, occipital bone, and mastoid part of the temporal bone. So we can see this is bregma. So this is bregma, which is actually the meeting point of the coronal and the sagittal suture, and this is lambda, which is the meeting point of the sagittal and the lamboid suture. And also we can see there is pterion. We can see this is the H-shaped suture, which is formed in front by the frontal bone, behind by the temporal bone, and above by the sphenoidal angle of the parietal bone. And below there is the greater wing, tip of the greater wing of the sphenoid bone. So what is the clinical importance of this region, pterion? So it is a common site for epidural hematoma. So now let's talk about the anatomical points. So this is the right-sided parietal bone. So anterior inferior angle is directed downwards and forwards and marked by the anterior division of the median meningeal vessels. And the superior border is the largest border and lies in the median plane. And external surface, it is convex and smooth and directed upwards. This was all about the anatomy and the presenting parts of the parietal bone. I hope you like it. Thank you.